Welcome back. If you didn't know it, August is Children's Eye Health and Safety Month. An increase of screen time and virtual learning can also have a harmful effect on young eyes. Dr. Christopher Browning of Vision Quest Eye Care joins me now. Good morning, doctor.
Morning, Scott.
Hey, the most common issue, and I know you and I were talking during break, is myopia. I now know what that is. Turns out I had it. Explain to our viewers what it is.
Well, people are myopic when their eyeballs are too long, and it makes it hard to see things far away because light falls in front of the retina instead of on the retina, so it makes things out of focus. It's commonly called nearsightedness.
So basically, if you're trying to see stuff far away, like when I was a kid, like the chalkboard or something like that, you couldn't see it. So what's the lifelong impact if you just don't do anything, if you leave it untreated?
Well, in addition to not being able to see well, and for kids struggling in school, it increases the risk for retinal detachments, myopic degeneration, cataracts, and glaucoma.
So what's causing, I'm hearing there's a rise in cases. Is COVID-19 also having an impact by chance?
Well, it's estimated right now that about a third of the kids in the United States have some form of myopia, and by 2050, about half the population will. So it's a dramatic rise. And we know that there's environmental factors as well as genetic factors, but the increased amount of screen time right now, we've seen it in our clinic, is dramatically increasing the amount of nearsightedness in kids.
So what can parents do to help out their kids? I know, as I think I was in 6th or 7th grade, I didn't want to admit that I couldn't see things far away. So I assume one thing is being attentive.
Yeah, the biggest thing is to make sure that kids get to spend plenty of time outside, which in the summer is a little bit easier. So if kids can spend 2 to 3 hours outside, that's ideal. In our office, we usually recommend to parents that there's an equal amount of time spent between screen time and outside time. There's a lot of studies that have shown the more time you can spend outside, the less likely you are to become nearsighted. In our office, we use some special techniques that are very personalized with regards to soft multifocal contact lenses that are customized, special types of rigid gas permeable contacts, and certain types of drops to help decrease the dependence on glasses and contacts.
All right, real quickly before we run out of time, I'm just curious, we talk about, hey, you should go to the dentist twice a year. How often should you go to an eye specialist?
Well, the American Optometric Association recommends that kids actually have their first eye exam between 6 and 12 months of age, around the age of 3, around the age of 5. Once they get into grade school, they should be seen on an annual basis because kids in many cases just won't tell you when they can't see well. And about 75% of pediatricians and school screenings will miss kids that are nearsighted and myopic.
All right, we have adults watching too, and I know this is about children, but what about for adults?
But, we've seen a dramatic increase in myopia in adults as well since we've been back in early May. And so for adults, it's usually a good idea to have your annual eye exam, especially after the age of 40. There's a multitude of diseases that can pop up. So visiting your local eye doctor can really be a head start, making sure that you don't have any lifelong problems.
All right, sounds good. Dr. Christopher Browning, thank you. And I believe I'm going to make an appointment because I've been having problems.